Hi everyone, my name is Henry Hyde and I'm an online creator. I have a Patreon website and I used to be a magazine editor, and I'm a writer and a graphic designer. I do a few things. Those people who know me know all that already. But in a sense, that's completely irrelevant, because the reason I am making this impromptu video that's completely unscripted, it's just out the top of my head, is because last week I was diagnosed with having prostate cancer. I have what's known as advanced prostate cancer, which is to say that the cancer has spread outside the prostate gland itself, which is known as a capsule. The prostate is contained within what's called a capsule, and it's spread outside of that into one of my lymph nodes. So to be technical about it, I have a cancer that is categorized as T3N1 with a Gleason score of 9, which means that some of the cancer cells are growing very quickly. So the doctors have decided to act immediately to put a stop to it. Now, I've been put on some tablets that are hormone suppressants, basically testosterone suppressants, because the male hormone testosterone can accelerate the growth of cancer cells. So one of the first things that they do with someone who's got prostate cancer is that they put them on a series of, a course of tablets, and there are different kinds of tablets. The tablets I've got are specifically targeted at the testosterone in a particular way, and that course of tablets may continue for years. I've heard stories of it could be anything from 3 years upwards. Someone who just sent me a message through Twitter said that he's been on the tablets for 4 or 5 years, and that treatment has to continue beyond any additional treatment that you might get. Some of the options for the treatment of prostate cancer, the immediate radical treatment of prostate cancer, can include surgery, but in my case that's not going to happen as a first option, partly because the cancer is spread outside the prostate, so they couldn't just take out the prostate gland and that would be the end of the story. Because it's spread, I'm actually going to have radiotherapy, and that can take a number of different forms. There's many different types of radiotherapy. In recent years, the options available are incredible. All kinds of high dose, low dose, very localized, more spread out. So I don't yet know what I'm going to have. I'm actually got my first meeting with my oncologist, which is a cancer specialist, next Friday. So just nearly a week from today. So it's only at that point that my actual course of treatment, radiotherapy, will be discussed. Something else that's available to some people is what's called brachytherapy, which is essentially the insertion of tubes containing radioactive material into the prostate gland itself. Sometimes the tubes are just placed in there for a few minutes and taken out. There's also a new therapy where tiny little pellets of radioactive stuff can actually be inserted into and left kind of semi-permanently in the prostate gland, which is amazing. But that is not something that initially is available to me, again, because the cancer is spread outside the prostate gland. Now, I'm making this video for a number of reasons. One of the reasons is I want to make you aware of prostate cancer. I was vaguely aware of it. In fact, one of my uncles died from prostate cancer. There are other people I've spoken to who have had prostate cancer, some people who are living with prostate cancer. And one of the things that's often said is that more people die with prostate cancer than of prostate cancer. and because it's a very strange disease. It's very unpredictable, and even now, here we are in 2019. There's all sorts of ways that the disease can manifest itself and spread. The rate of growth can be highly variable. But I thought I'd tell you my story so that you, particularly if you are a guy who is over 50, 55 years of age, and if you're a black guy who is aged 45 plus, because apparently it can affect black men earlier than Caucasians, go and get yourself checked. And there's a number of ways that you can get checked. In my case, it was random happenstance that meant that I ended up getting what's known as a PSA blood test. PSA stands for prostate specific antigens, and those are chemicals basically that are put out into your blood by the prostate gland, and if they get too high, that is often a sign of cancer. Now, in my case, my PSA blood test came back with a score of 7.7, which is considered marginal, so that wouldn't have necessarily indicated that I did have prostate cancer without further tests. Whereas there are other people who I've had correspondence with and spoke to had enormously high PSA scores, huge scores. There's a guy who I was just speaking to today who had a PSA score of 50. There's another guy I spoke to who has survived, let me make that clear, who had a PSA score of 1,000, which is unimaginable, just unimaginable. So my little puny score of 7.7 might have just indicated some kind of other inflammation of the prostate gland. Now, that check my blood test came about because I'm type 2 diabetic, and I have twice yearly meetings with a specially trained specialist nurse at my local GP surgery, and they just take some blood and check what my blood sugar levels are and whether I'm keeping the diabetes under control, and we discuss whether to amend my diabetes medication and that kind of stuff. But also, as part of those meetings, I'm asked a number of questions related to, have I noticed any other symptoms? Have I noticed any worsening of what I would know as diabetes-related symptoms, or have I noticed anything else in my general health-wise? And they have a long list of questions, and it's usually, no, none of that, no, absolutely fine, that's fine, that's fine. But somewhere towards the end of the conversation, I was asked, was there anything else that, has crossed my mind? I said, well, funnily enough, I think, and I couldn't be sure, but I think over the last 6 to 12 months, maybe I've noticed a bit of a change in my urine flow. Normally, as a guy, you go for a wee and whoosh, out it comes, you're done, okay? I've noticed in the last 6 to 12 months, that's still mostly the case, but sometimes, just sometimes, maybe the flow seems a bit more restricted. Maybe sometimes it has a bit of a rush, but then it sort of pauses at some point, and it's almost like then I have a reserve tank to empty. That's the best way I could put it. And the nurse said, oh, that's interesting. Okay, well, probably because of your age, and I'm 58 now, we should have a PSA test done on your blood. Normally, because you're over 55, they should have probably done it as part of the battery of tests they do automatically with your diabetes bloods, but for some reason, administrative cock-up or whatever, they appear not to have done. So let's just take a bit more blood and we get a test done. It's probably fine. Well, I got a call from the surgery a couple of days later. I wasn't actually able to take the call immediately, but I had to get back in contact with the surgery after a bit of a wait. What it's like trying to get through to your local GP surgery these days. You're sat listening to boring music. You are number 53 in the queue, or whatever it is. Right? Managed to get through eventually, and made an appointment with my GP. And when I saw the GP, they confirmed that yes, my score was abnormal. 7.7. Usually a score should be below about 3 or 4. So if it's above that, it's classified as abnormal, but the score was, borderline, not huge, but best to get it checked out. So the first kind of test that happens is you drop your trousers, lie down on a bench, and the doctor puts his finger up your bottom. That's known as a digital examination. There was me when he said, "Oh yes, I'll perform a digital examination." So you think something wonderfully electronic with some fine, amazing gizmo is going to happen. No, he meant digital, as in these digits, the fingers. So finger disappears up your bottom, and you get a peculiar sensation when he has a bit of a rummage around and feels your prostate gland. And having done that, he said, "Oh yes, I can feel it doesn't feel enormously enlarged, but he actually said the texture felt strange to him." So the best thing would be that combined with the PSA blood score, get me referred to a consultant, which is actually in another hospital a few miles up the road. So I got that follow-up appointment, I think it was about a week later, a week or 10 days later. Went up to Haywards Heath in Sussex, the hospital there, and got to see the consultant's registrar, in fact, who did another digital examination and confirmed that it felt abnormal to him. And so I was then going to be referred on to the next stage of the process. Now, the next stage in the process used to be, until relatively recent historically, used to be straight to a biopsy. But in my case, and because of modern technology, the next stage is actually an MRI scan. So again, it was a couple of weeks later. So that's probably now about a month ago, in September. I was sent for an MRI scan, this time at Brighton Hospital, and was put into this amazing kind of Star Wars machine with all blinking lights and buzzes and beeps and goodness knows what, and you're enclosed in this sort of donut. And the MRI scan focused obviously on my prostate gland, so that's sort of just around the level of your belly button, or just below the belly button in the kind of pubic region. That lasted about 40 minutes, and for that process to be possible, I was given 2 drugs via a catheter in my arm here, and those 2 drugs, one of them was to relax my kind of internal muscles, the muscles in my bowel, and the other one is to actually enhance the image. It's got some kind of stuff in it that is affected by the huge, very powerful magnets in the MRI scanner, and they kind of just momentarily, literally in a fraction of a second, they kind of stand on end or line up, which gives more contrast to the image that they're taking, helps with the MRI scan picture that they end up with. So as I say, that lasted about 40 minutes. It was a peculiar experience. It was a bit like an alien abduction. It was very strange. It was painless. I had no pain. I had more discomfort, I think, from the catheter that they put in my arm rather than from the scan itself. It's quite tricky because you have to lie very still for, half an hour to 40 minutes while the scan's being done. And if you're claustrophobic, you need to let them know, because it can be a bit strange being sort of inside this, quite tight fit donut machine thing that you go into. But, completely painless. I came out feeling a bit dizzy, a bit thirsty, but no other bad side effects from the scan itself. I think I might have had a slightly adverse reaction to one of the drugs, because they give you this bowel calming medication through your arm, and I think that gave me a bit of a tummy upset a few hours later, but nothing major. So anyway, the bottom line is that the results of the MRI scan, when they eventually came through, confirmed the fact that I have got a growth on my prostate gland, and that they therefore needed to do something more. And the next stage was back in Haywards Heath, again, it's a couple of weeks later, So that was just about 2 weeks ago when I went for a biopsy. Biopsy is effectively they take tissue samples from the prostate gland through the prostate gland. They actually took something like 8 or 10 samples in all, because they have to kind of go in via your rectum, and they send in a needle, basically, a hollow needle that just fires into your prostate gland very quickly and takes a kind of a worm-like sample that's about 2 centimeters long by a millimeter wide from your prostate gland. Now, the way they do that is you go to the hospital. Before you get to the hospital, about 2 hours before the procedure is due to take place, you are given a large antibiotic tablet to take. So you take the antibiotic tablet. Then when you get there, you're given another oral antibiotic tablet. Plus, then they give you more antibiotics via a catheter in your arm. So once that's all been rigged up and you've taken this additional tablet, and they have to give you so many antibiotics, because when you think about where your prostate gland is and how they reach it, they obviously reach it via your backside. And, you know, poo travels down your backside. So if there's anywhere in your body that's liable to infection, that's going to be it. So they give you lots of antibiotics to make sure, if they possibly can, that you don't get any kind of post-operative infection. Now, it can happen. In rare cases, some people still do get an infection. If you do feel any signs of infection, such as, fever coming on, or strange aches or pains or whatever in that part of your body, get yourself to a doctor straight away. In fact, they recommend that you maybe go straight to accident and emergency and tell them that this is what's going on. But that is quite rare. And I have to say, given the amount of antibiotics that you're given, that are obviously then long-lasting beyond the procedure, it is, it's relatively rare for someone to have post-operative infection from the biopsy. But you still need to be aware of it, okay? Now, the procedure itself, you lie on your side. It tends to always be your left side they ask you to lie on. Never asked why. Perhaps I should ask them next time why it's your left side you end up lying on. And then there's a team of people. I mean, in my case, there was the guy actually carrying out the procedure. There was his assistant, and there was also a doctor present, maybe a training consultant, who is kind of watching what's going on. Now, the guy I had at Hayward Heath Hospital, his name was Mac, he was absolutely fantastic. I asked him, how you've done quite a few of these, I imagine, and he said thousands. In his case, he's probably done most of the men aged 50 plus in the county of Sussex. So he was extremely competent. He was also, I need to really make this clear, they were very keen to make sure you understood what the procedure was going to be. He was very keen, if you had any questions, any, doubts or misgivings, talk to the person who's doing the procedure. They will explain it calmly and quietly and make sure you understand exactly what's going to happen, okay? And don't bottle things up. If you've got any misgivings, anything, you're worried about, ask them there and then. That's your opportunity to kind of have your say. And in my case, I said I wanted to be sure, having spoken to various people about this procedure, that he just kept me informed at every stage exactly what he was going to do. So when he was going to give the anaesthetic injection to warn me that was coming, when he was going to fire the gun to take a biopsy to warn me he was about to do that. So nothing came as a shock or a surprise, okay? And that made a huge difference to my sense of well-being during that procedure. And I felt like I was being listened to, and that was really important. And Mac and his assistant were brilliant, okay? And now, obviously, the fact is, it's relatively embarrassing, but, not everyone likes to drop their trousers and offer their backside to a group of people behind you, right? That's not a natural thing to do. It's quite, naturally you're going to feel awkward, embarrassed, or whatever. But this is where the communication is so good, and these people were absolutely professional, completely professional, and it was a huge comfort to know that I was in the best possible hands. These people have enormous expertise in what they're doing, and of course are aware, because they've done it so many times, of what the patient, you as the patient, are going through, not just physically but psychologically. Okay, don't underestimate the psychological impact of all this. All right. So the procedure itself: lay down on your side. Obviously, you've got the antibiotics that you've had, and the first thing that happens is they move into your backside and they apply an anaesthetic to the prostate gland. Okay. Now, there's no way of getting around it. I wouldn't necessarily describe it as painful per se, but it was certainly, pretty unusual. A bit, very strange. Very hard to describe. The only way I could describe it is if you've been to the dentist and you've ever needed work done on your root canals, and the dentist administers an anaesthetic injection to your gums, it's kind of the equivalent of that. I'd be kidding. It's not pleasant, right? That is not pleasant. But I would also say that is the least pleasant part, or the most unpleasant part of the entire procedure, the administration of those initial injections to completely numb, anaesthetize the prostate gland. So once that's over and done with, and it's a matter of seconds, really, probably, like all these things, because you're focusing on the experience, it seems longer than it actually is. It's a few seconds of this really weird and, I don't want to go through that very often kind of experience. But once that's done, then, as I say, he announced they have this gun. I'm not sure how it's powered, a pneumatic or spring-driven. I should have actually taken a look at it, shouldn't I? I'm sure you could look it up. But there's this gun thing that basically shoots a needle at high speed into your prostate gland, takes out a sample, and that's it. I mean, it's literally a fraction of a second each time. And it was because the anaesthetic had been given time, and again, that was something else I discussed with him. Please ensure that the anaesthetic's been given enough time to take effect. Don't rush it. All I felt was a kind of a dull thud. Again, unusual. Certainly not painful, just a bit weird. And so, they're manipulating the prostate so they can get this gun to take samples from all sorts of different directions into the prostate to make sure that they've covered the entire prostate gland, plus a bit outside. Okay. So, as I say, the whole procedure, oh gosh, it'd be hard to say. Less than half an hour I was in that room. 20 minutes, I couldn't really say. I mean, one of the strange things when anything is being done to you kind of surgically is that time goes a bit, and it's hard to tell how long anything's taken. But I reckon, the people who were waiting for me outside, bless their hearts, were surprised how quickly, it was all over and I was back out again. So, yes, I think it was probably about 20 minutes, maybe. What they're also doing at the same time is they have an ultrasound probe, so they're getting a picture of the prostate gland, matching it up with the scan that was done by the MRI scanner people, and so they can accurately send in this device to take the biopsies. So there was a bit of setting up to do. There was some technical stuff to do. They were obviously checking that they'd got good samples. They were checking that the picture was clear and that they were targeting things accurately. But as I say, I think it was probably about 8 or 10 samples they took. So it wouldn't have been that long. So probably 20, 25 minutes I was in that room. When they've taken all the biopsy samples, they very kindly clean you up because they've used obviously gel to help minimize discomfort. So there's a whole load of sort of like KY type jelly that's gone up your backside, and so that's all cleaned up for you. And then, and you have to laugh about this, they give you a panty pad to put as in a panty liner to put into your underwear for your journey home. there's no other way to put it. You know, those of you who are you know, married or live in a relationship with a woman who uses panty liners with wings, you know exactly what I'm talking about. These are large ones, right? And the idea is obviously it's two things. Potentially, you may get some bleeding from the back passage. Okay, you may get some bleeding from the back passage. I didn't actually, but I was glad I had the panty liner in because some more of the gel had come out, so at least my underwear was protected. But yes, it also helps, you know, to spot if any blood has come out or anything else. Okay. I was lucky. I didn't have any bleeding from the back passage afterwards. I don't know whether that's usual or unusual, but I was fortunate, so that wasn't a problem. But they do warn. They give you, you know, leaflets, literature, letters to go along with this appointment that warns you that there may be some bleeding from the back passage. You may notice some blood in your urine. I didn't have that. If you're sexually active, you may notice some blood in your semen. I'm going to be honest. Yes, I did notice that. These are things that are obviously very difficult to talk about, but they are side effects of that procedure that you can experience, and therefore you need to know about them. And expect them. You only need to worry if they continue more than a few days. Depending on what you read, it could be, you know, anything from a few days to maybe, you know, a week to 10 days. But certainly if you're experiencing any of these things beyond that, and certainly if you notice any symptoms of fever or anything of the kind, you should contact your doctor or get yourself to A&E. Okay? But the vast majority of people won't have any complications. So that was the biopsy. One of the things I'll say psychologically is the biopsy took me by surprise. It affected me emotionally. There are reasons for that I've discovered, because it actually, you know, from a psychological point of view, it stirred up a very long distant memory of something completely unrelated, of when I had suspected appendicitis when I was a child. And you need to be aware of the effect that any surgical procedure, and certainly something like that, which is terribly intimate, can have on you, and talk to someone about it. If you're lucky enough to have access to a therapist or some kind of counsellor, or, you know, even just talk to your GP or your specialist nurse, that can be really helpful. But it's really important not to bottle this stuff up, because if, like me, you've got more stuff that's going to be coming along, and you're going to be confronted with a long series of sessions that may be psychologically uncomfortable as well as physically uncomfortable, you need to address these things. Okay. So anyway, I had the biopsy done, went home, and again, it was about 2 weeks. They'd actually, at my first appointment, when I went to see the consultant at Haywards Heath Hospital, they pre-booked me an appointment for just a few days ago, on the 16th of October. Maybe thinking that maybe it's because they knew that if I did have to go through both the MRI and the biopsy, that it would be about that date when they would get the results. So I didn't have to make a separate appointment to get my results. I just went along to this pre-booked follow-up appointment where they gave me the results. And that was last Wednesday morning. And again, it was at Haywards Heath where I saw the consultant. In this case, it was Mr. Coker, but depends where you are. And I was given the news that they had found cancerous material, and moreover that they discovered that the cancer had moved beyond the capsule, as it's called, of the prostate gland itself, and had entered one of my lymph nodes. Hence that thing, the T3, which is the state of advance. The N1, the fact that it has entered at least one of the lymph nodes. And then the Gleason score of 4 plus 5 equals 9. Now, the Gleason score is a measure of how fast they think the cancer is growing. So the 1 is the kind of average measure. They think the average of all the cancer cells are growing at a rate of 4, which is quickly but not massively aggressively. I think that's right. But some, the ones they found that fastest growing, were 5, at a speed of 5, which is much faster, which basically means they need to get on with it. So they then add those two scores together, so the average and the fastest one, and that gives you the Gleason score. In my case, it was 9, which is, I have to say that that was more worrying than I had been quite prepared for. In my head, you rehearse these things in your head, don't you? How am I going to cope when they tell me? And I'd kind of imagined, well, okay, maybe because the PSA score is relatively low, maybe it's just some other kind of inflammation that I've got that isn't cancerous, and so that would be treatable via some other way, some form of prostatitis, as it's known. I'd also, I suppose because of talking to, a couple of good friends who've had this, had reconciled myself, okay, well, it could be cancer in the prostate. And therefore, I'd already spoken to a good friend of mine who has been through this and thought about, oh, well, maybe they'll give me the brachytherapy and, these radioactive pellets and whatnot. And okay, I could understand that. The score's quite low, but I suppose that's possible. I hadn't prepared myself entirely for the news that it had been more aggressive than that, and actually grown outside the prostate into one of the lymph glands. Or lymph nodes. That was a surprise, a bit of a shock, and then being told, well, immediately that the route I needed to go down would be the radiotherapy, and that they were going to put me on hormone tablets straight away. I mean, they literally wrote out the prescription right there in the room, handed me the prescription, said go upstairs to the pharmacy and get these tablets. Then what happens is they have a medical team meeting, because as soon as you become a cancer patient, they put together a team of people consisting of, the consultant, the oncologist, the specialist nurses, and Macmillan, and so on and so forth. A brilliant system they have in the NHS, actually. And so they have a team meeting and decide what treatment to proceed with and how quickly to proceed with it. And so I got a call later that same day, just a few hours after the appointment, telling me to start taking those tablets, 1 a day. And psychologically, I needed to get on, come to terms with the fact I might be taking those tablets for years to come. And that's quite a lot to grasp. And then being told, well, depending on the type of prostate cancer or infection you've got, you might be given all sorts of range of options, and you might have to go and have meetings with this consultant or that consultant or this specialist or that specialist, and then you can decide, almost like from the shopping list, of, oh, I fancy that sort of treatment. Depending on also what kind of lifestyle choices you want to make. There's all sorts of complicated factors. In my case, there was no choice involved. It was, there you go, that's what's wrong with you. This is the treatment. We're starting it now. And I had my first appointment with my oncologist at the Royal Sussex County Hospital in Brighton on Friday, the 25th, when we will discuss my treatment. And also, it was at that first meeting, with that consultant, I was given 2 booklets, both incredibly informative. One by the Macmillan Cancer Charity, all about advanced prostate cancer and helping you with masses of information, helping you to understand what the disease is, how it's been classified, what the potential treatments are, what the potential side effects are, how you can live with both the treatment and the side effects. It's quite a thick little booklet, actually, brilliantly put together. The other one is from Prostate Cancer UK charity, which describes living with hormone therapy, because obviously as a man, you're used to running around with lots of testosterone coursing through your veins, and you're put on hormone therapy to immediately quash those testosterone levels, which of course then means that you're, as a man, you're imbalanced, and so your feminine hormones, such as they are, kind of take control, and there are potential physical and psychological side effects to that. And I think this is one of the things, when I'm explaining to you and when I'm bumping into over the next coming months and years, people who I know need to understand that as much as the physical effects of the treatment I'm about to receive may change me in some ways, there's also the emotional side of the treatment, the side effects of the chemicals that are just going to be coursing around my veins. That means, for a start, and I'm already noticing this, I and people undergoing this sort of treatment are likely to become much more emotional, much more, you could say, if you want to put it in simple terms, your feminine side is likely to come to the fore. And I already noticed, sometimes you might just burst into tears for no apparent reason, something tiny, and it might be something good as much as something bad. What can I say? I go back and revisit all those romance movies I poo-pooed in the past. We'll see. But people need to be made aware of that, and also that it's different for every cancer patient. The chemicals and the treatment can affect you in different ways. Some people get away with no side effects at all. Lucky them. Some people get an awful, appalling battery of side effects, ranging from hair falling out to, strange bleeding to, nausea and vomiting to, strange. One of the risks, of course, of hormone treatment is breast growth. Or sensitivity. I've been warned that the tablets I've been put on can cause breast sensitivity. So someone might, playfully slap you on the chest, and you might find it blooming painful, something like that. I'm paraphrasing, but if you know someone who's going through this, or if you're about to go through this yourself, then you need to understand the side effects and the symptoms of the side effects as much as the disease itself. Because the fact is, I've got prostate cancer, but I don't feel ill. And I've been told by the consultant that the disease itself, unless it got very advanced and started spreading around my body, what's known as metastatic cancer, and you want to avoid that at all costs if possible, I'm very unlikely to feel any pain from the prostate cancer itself. I mean, if it had got extremely big, then obviously I might have all kinds of problems, and there's, erectile dysfunction, real difficulty in urinating, all manner of things could start coming to the fore. And obviously, if cancer gets into your bloodstream, that can be really appalling. Or travel all the way around your lymph nodes, that can be really appalling. But it's different for everyone. There's no blanket answer to this, no blanket solution. And so I'm going to be making regular videos talking about the treatment I receive and the side effects, symptoms that I notice, in the hope that might just help make you more aware, that you will see how I'm coping, and hopefully that might help you to have a bit more hope and courage if you end up facing it yourself, or if someone you know and love faces this kind of thing. Why am I doing this? Because, for that, if you like, to help educate other people in a way that I wish I'd been educated, because this has come as a surprise and a shock to me, and I suddenly realised, oh yeah, well, I had that uncle who died from it. I never got the chance to talk to him about what it was like. I didn't live anywhere near him, and he was sadly gone. And I have to be blunt and honest and say, maybe it wouldn't have occurred to me to, I would have offered lots of sympathy and love, but it wouldn't necessarily have occurred to me to ask him to, what's it like? Which is a tragedy. So in a sense, if I can help you feel that sense of loss and, oh, if only, after the event, by explaining what's happening to me, then that will have done hopefully a good service. But also, it's to help me. One of the reasons I'm doing this is to help me as much as to help you, because by talking about it in this way, by trying to learn as much as I can along the way to understand what it is I'm facing and the side effects and the symptoms and so forth, that is a huge help to me to kind of stop it being just this thing that's consuming me alone on my own, and instead turn it into something that I can kind of tackle intellectually as well as emotionally. And by studying it, it makes it small, like by putting it under the microscope, putting my disease under the microscope, instead of it being this huge thing that's going to crush me from above kind of thing, it becomes this little thing that I can study. It helps me to prevent the cancer from dominating me, and instead I want to dominate the cancer. If this is a fight, a lot of the people watching this I know come from my gaming community. And if you're planning a battle, a game, you make a plan, you sit down, you make a plan, and one of the things you do is you reconnoiter, you get to know the enemy as well as you possibly can, so that you stand a better chance in defeating that enemy. Right? Same if you play sports. Maybe you don't do the wargaming like I do and many of the people I know do, but you study your opposition, don't you? Who are the best players? What are they particularly good at? How can you put them under pressure? How do you optimize your chances of winning that game? In the same way, how do I win? I'm going into battle. How do I win the battle? And I know, in fact, actually what I'm going into is a war, because it's a long-term thing. And I just mentioned that in my case, I'm having a discussion with my oncologist next Friday, but from what I understand, with radiotherapy, what's likely is I'm going to have to go in every day for a couple of months. I think it's Monday to Friday for 2, maybe 3 months, and have a quick zap every time I go. And so that's quite a big thing, knowing that, oh my God, I'm going to have to go in for multiple sessions. What's that? In a month, 20, 40, 50 sessions of a few minutes of time, when they just, lie me down on this thing, a bit like the MRI machine. I've got to lie in this tube, not move for 5, 10, 20 minutes, whatever it is, while they zap me, sending in beams of various sorts to, blat that zone, my prostate and the area just around it, the lymph node where it's got into. And so that's going to be tiring. It's going to interfere with my schedule, that's for sure. It means that, yes, I may well end up with some side effects that are quite unpleasant. Apparently, I might even get a burn mark of skin burn, effectively, on the outside of my skin, in my pubic area. That'd be interesting. The pubic hair might fall out. Way. I might get kind of irritable bowel syndrome. There's all sorts of things that could happen to me physically that are like the ew aspects that no one really wants to talk about. But it does mean that if I encounter any of you and I suddenly say, God, I really need to go to the loo, or, oh God, I feel really sick, you'll understand what's going on. It's not just because I've eaten something funny, it's because I'm going through this course of treatment, and that's what can happen to you. Completely involuntarily. Nothing I can do about it. There's nothing you've done wrong. Similarly, we might be in the middle of a conversation, I suddenly burst into tears. Not your fault. Not your fault. You might be being wonderful, and not your fault. But suddenly, this kind of wave of emotion can come absolutely from nowhere, totally from left field, and suddenly there's tears running down my face. Wow. So you just need to, stay chilled. Don't think it's you. You've not said anything wrong. Just, give me a pat on the back, lend me a tissue. I'll be fine. Give us a couple of minutes. Okay. On the other hand, obviously I'm a bit of a public figure, within a small confines of my niche, and people are used to me being very kind of upfront like this and talkative and chatty and very approachable. There may be times when I just say, do you know what, I'm going to go in my bunker for a few days, because I have to think. I've got to think of me first. I've got to think of how can I cope with this ongoing thing that's happening to me, both in terms of the physical treatment, in terms of the hormone therapy, and just the other blunt fact. Here's another thing. I want to stay as productive as I can. Why? Because I'm self-employed. That's the first thing. I have no sick pay. I have no savings to speak of, and because I'm self-employed, there are almost no benefits that I could claim from anyone. I don't have any insurance that covers this eventuality, because I've had various insurances over time. And one of the funny things is I have a hospital plan where if I'm put in hospital for a month or more, I can claim on it, because the whole thing with this is it's all done as outpatient. I'm not stuck in hospital, so I can't claim on that policy. So basically, folks, I've got to keep working. I have to stay productive. I have to keep writing. I have to keep podcasting. I have to keep doing my graphic design work. I have to do all those things. So if you want to support me, buy my stuff, right? Become a patron, even if it's only for $1 a month. Every $1 a month, man, it's going to help me to get through this. That's for sure. But, bottom line is, if you want to really be helpful, buy my stuff, encourage other people to buy my stuff. Simple as that, right? Because that's the only benefit plan I have. I have to keep working. If I stop working, it's not going to be good. And of course, that's one of the things I'm dreading, is that from the potential side effects. If I'm finding I'm constantly exhausted, can't stay awake, I'm throwing up all the time, or some of the even worse side effects you don't want to know about, or I may end up telling you about them in due course. But as a self-employed person, this is my business, this is my livelihood. My partner Anne, she's also self-employed. So, if she ends up having to give me lots of additional care, that would be extremely unfortunate, because it would prevent her from working too. Then we'd really be, pardon the French, up shit creek without a paddle. So, the bottom line, pardon the pun, of this video, which I'm going to wrap up now, is thanks for watching. A huge thank you to everyone, particularly on Twitter and Facebook, who have sent, as I said the other day, a tsunami of kind of sympathy my way. Absolutely. I thought a couple of dozen people might respond to the post I did. 400 odd and still counting people sending likes and comments and stuff. I'm completely blown away. I can't tell you how much that means to me. That is absolutely wonderful. And I'm especially grateful to those of you who have been through this or something similar, getting in touch, sending me messages, explaining the journey you've been through and the fact that you survived it. That's enormously encouraging to me. So thank you so much for having the guts to, open up about what you've been through to help encourage me in what I'm about, facing now. That means an enormous amount to me. So thank you incredibly for that. But also, this is, if you like, a manifesto that my intention is to all my fans and the people who support what I do and my patrons and so forth. My intention is to be here for a long time to come. I am going to fight this with everything I've got. I intend to redouble my efforts to lose weight, to stay healthy, and to be as fit as I can, physically and mentally, to cope with what's going to be coming my way. And the encouragement that you guys give me will make all the difference in my ability to pull through this, come out the other side in in a good state. Simple as that. I want to come out the other side of this feeling right. Okay, I had obviously been through a war. I can't avoid that, but I've won the war, and I am open for business in every way possible. So thanks everyone again. Your best wishes and everything, and my best wishes to you, and especially to those people who have, as I say, opened up about their own journey through this ghastly experience. And the final message is, and I'll say again, if you're a guy who's, Caucasian guy, 50 plus, if you're a black guy, a bit younger than that, go and get yourself checked, because if this video can achieve anything like preventing any of you from going through this, or mean that those of you who might leave it too late get checked in time so it's more treatable, go and get yourself checked. Just go and talk to your GP. It's, at the bottom line, it's a blood test and a finger up your bum, but believe me, it can save your life. So go and get it done. Thanks everyone for watching, and I will see you again soon. Bye.